Okay, well, it is 1 o'clock Mountain Time, 3 o'clock Eastern Time, so we're just going to go ahead and get started. Welcome to today's webinar on the impact of environmental health data at state and local health departments. This webinar is being brought to you by the National Environmental Health Association on behalf of our Informatics Committee. So my name is Becky Labo, and I'm the evaluation specialist with NEHA, and along with my colleague, Chris Walker, who you'll meet in a little bit, we help facilitate NEHA's Informatics Committee. So just to give you a little background on what this Informatics Committee is our mission is to be a resource for environmental health professionals and leadership dedicated to developing informatic resources and programs, increasing workforce capacity, and fostering improved data utilization to protect public health. So we're tasked with several different activities. We help identify and make recommendations related to training gaps, needs of the profession, and emerging issues. We help identify best practices, successes, and challenges for environmental health professionals and data utilization. We provide guidance, input, and participation in the development of NEHA's informatics program. And then we also help promote and disseminate informatic related materials and resources. So the members of our committee are comprised of local, state, federal, and industry professionals with environmental health and data expertise. So why is data important to our field? NEHA really believes that adopting the use of informatics and reliable data is a central pillar to decisions in all of environmental health. So data that's collected can really make an impact on core environmental health functions across all areas, such as food, safe drinking water, aquatic facilities, on-site wastewater, air quality, just to name a few. So today's webinar is really going to focus on environmental health data that's collected at the state and local health departments. And we're going to be having a panel discussion on how environmental health data has impacted policy or practice, and how it has and can be used to identify emerging environmental health issues and needs at the state and local health departments. So our first speaker today is really going to set the stage for us. So I would like to introduce Dr. Timothy Dignam, who works for the Centers for Disease Control in the National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry. Since 2019, Tim works in the Office of the Director as the Deputy Associate Director for Science. And in this role, he oversees scientific concept approval and the review of all NCEH and ATSDR products. He also serves as the Data Modernization Implementation Lead. And in this role, he's a conduit for facilitating change for expansion and acceleration of data improvements to address critical areas of need. So prior to this, Tim served as acting chief of the lead poisoning prevention section and as the deputy associate director for Science Division of Environmental Health Science and Practice. Prior to working at the division level, Tim worked as an epidemiologist in the Child Lead Poisoning and Prevention Program. So Tim earned a Bachelor of Science in Microbiology from the University of Massachusetts Amherst, a Master of Public Health and Epidemiology from Emory University, and a Doctor of Philosophy and Epidemiology from the University of Alabama at Birmingham. So we're really excited to have you with us, and I will turn it over to Timothy.
Okay, thanks, Becky, and thanks, Chris, for the invitation today. I'm here to talk about the goal of data modernization at CDC, and I know Chris has some slides for me, which I am not able to see yet, but I'm sure are coming up quickly here. So data modernization has never mattered more than it does now. The initiative that we're undertaking at CDC has been going on for 2 years. It's funded by Congress, and it's rapidly expanding and accelerating the areas that we've identified as critical. And obviously COVID has exposed a lot of the issues that we had, and we're trying to correct those issues. So Chris, I'm on slide 3 when they come up. I don't see them yet. So all of our work is aimed at solving longstanding problems faced by public health that many of you probably know about: siloed information, heavy burden on providers who have to share data through numerous systems in different ways. I was in a meeting the other day and I learned that we get data in over 160 formats, outdated skill sets, patchwork of policies, older technologies, federal incentives haven't been aligned with what we do. So these are the challenges that we face. And now I'm on slide 4. We have a written plan for how we're going forward. We published it. It's called the Data Modernization Initiative Strategic Implementation Plan. And we're on the second version of that. And this slide just describes the 5 big areas: building the right foundation, which means bringing public health technology to a level and standard already in place outside of public health, including cloud-based infrastructure, a North Star architecture where everybody can go submit data to us at a one-stop shop and can also output data there, accelerating data to action, which means using the data to predict and forecast better, developing an improved public health workforce, supporting and extending partnerships and policies, and finally managing change through our governance, and which is something that we are completely overhauling, how we network ourselves together. Instead of a siloed governance, it's a unified governance. So slide 5 is the next slide. And obviously you all know the world of data is changing rapidly. We're in the middle of a data revolution, which brings increased complexity to our work. And it also creates opportunities for us so we can start thinking in ways that we had never thought before. So the big question that we're addressing is, how can we harness the strength, the expertise that we've built with you all and our partners and at CDC while overcoming these technological challenges to be one public health community. And so how we're doing that is the next slide, which just talks about data, people and partners, and policies. So on slide 7, here we just talk about that we're just not interested in having data, but we're interested in what the data are used for. So our central mission with data modernization is to move data to when and where it's needed to support public health decisions and more equitable health overall. And we know it's not enough to simply connect the pipes. We have to have a shared, common, and robust infrastructure that helps the data flow across our ecosystem. So we're working closely with our partners to develop the North Star data architecture, which is a flexible but standard way for our state, territorial, local, and tribal partners to get connected. And it's going to be in a cloud environment. It's going to have these plugins that are offered so people can use what technology they have to connect to it. It will also preserve the autonomy of our partners. And this is really one of our biggest next steps for reducing the burden on everybody for data to flow. And we actually have 2 programs in our center, the National Center for Environmental Health and ATSDR, that are involved in this accelerated pilot trying to use this North Star architecture. One is lead poisoning prevention, and the other one is our newborn screening program. And each center at CDC has been selected to have 2 big programs that contribute. So slide 8, CDC has already made incredible progress during the COVID response. For example, we receive data on every encounter from over 70% of emergency departments right now. The path that we built for COVID laboratory test results, we're handling 1.5 million results per day. And we're also deploying a new system for coding cause of death that fuses newer natural language processing and machine learning technologies. So we plan to build on what we've learned through COVID, take the good, drop what didn't work, and then move us forward. The next slide with the maps of the countries is just to show that we have a massive expansion of electronic case reporting. And this is one of the biggest successes to come out from the pandemic. Before the pandemic, we had 187 healthcare facilities using electronic case reporting. And by August 2022, we had 14,000 facilities in just about every state except one. So we're happy with that progress, but we still have a long way to go. For example, we're still only getting data from a representation of 12.5% of the hospitals. So we also, the great thing is that these capabilities expand beyond COVID. we're moving in, to improving in the 100 reportable conditions that we have. And for example, 36 states have began reporting on mpox cases as of July 2022. So obviously we have a long way to go, but we are seeing progress. Slide 10, we need to recognize that people's expectations for what public health can do are at a different level. And we know these are big goals. We haven't met them yet, and we have a lot of work to do. Some of you might have heard we stood up a new center. It's called the Center for Forecasting and Analytics. So we're really looking to take these predictive skills to the next level. And this slide here provides a proposed outbreak of a novel pathogen. What would the steps be that we would take for that? Okay, people. Obviously, the future. If we're going to be successful, we need to have the right people. So maybe the biggest difference in today's data modernization efforts is the commitment as a community that we have around this effort towards shared success. And also, change is hard, but we need to come together and make these changes. And I see it firsthand every day that it's very challenging to do, but we are doing it, and we're doing it with collaborating, with our state, territorial, local, and tribal partners. Next slide. We've put some new structures in place that will allow us to listen, learn, and work more effectively with both our private and public partners. We just recently stood up a new consortium for data modernization, which is the goal of which is to seek individual perspectives and experiences to inform us in our planning, engagement, and strategies. And I believe NEHA is a partner in that, is a member of that consortium. And we're also leveraging our longstanding collaboration with the CDC Foundation to extend partner engagements into the private sector and reach a broader group of stakeholders through facilitated industry listening sessions. Next slide. So in line with our DMI priorities, our data modernization priorities, we've been taking a variety of innovative approaches to build a state-of-the-art workforce, both at CDC and in our jurisdictions that we partner closely with. So we are recruiting and building through fellowships. We started an infrastructure grant, and Public Health AmeriCorps we're funding for data modernization. We're offering training for data science upskilling. And we're also forecasting future needs through the Public Health Workforce Research Center and HRSA's National Center for Health Workforce Analysis. Policy is an arena that DMI is focusing in on. We know that if we have the right policy, that we can have profound effects. And so we need to ensure that we have the right agreements and relationships in place to support the modern data exchange. Next slide. We need to look more broadly at the policies that impact how we share data across public health. One thing to note here on this slide is policies have been making a powerful difference on the COVID response. For the first time under the COVID Public Health Emergency Declaration, we began directly receiving reports of lab tests, hospitalizations in nursing homes, and long-term care data that were not available nationally before the pandemic. Next slide. Yes, partners. So a big next step in modernization is working with our partners to make data available across all of public health at the same time and in the same ways, whether an emergency is happening or not. So this includes promoting adoption of interoperability standards, aligning with federal policies, and exploring data authorities. So the CDC front door concept is this single point for moving data into and out of our agency so that public health actors and state and tribal, territorial, and local partners can use the data in the data exchange. And like I said, it's made up of building blocks. So this is a central architectural component supporting the CDC front door. It will standardize and streamline data ingestion over time, and it will route and deliver data into our EDAV. And our EDAV is our Enterprise Data Analytics and Visualization platform, which is a series of cloud-based tools and services located within the cloud that allow us to do everything that we need to do with our data: ingest, transform, analyze, and visualize. So the data, all of our activities are migrating to this EDAV platform, which is really powerful and getting us away from the siloed nature that we had in the past. The next slide is slide 17. And this just talks about some of the focus groups that we're doing with our partners. Next slide after that. I just wanted to share that there have been focus groups that have occurred, and 4 areas, 2 of which touch environmental health. One was lead poisoning, the other was HIV, Legionnaire's disease, and listeria. And so basically we took these focus groups to ask about all of the challenges from soup to nuts about transmitting data and using the data in these areas. Next slide. And this was our focus group timeline. And you can see the focus groups ended November 17th. So that data are now being analyzed. Slide 20. Everything we're doing with DMI touches an important piece of the public health ecosystem. You can advance that a little bit. It'll populate. Yeah. We are working to have the same systems being used for many health threats. So we call this disease or program agnostic. We're trying to get away from the content areas and get more into a systematic approach. So data are there and it's already ready when you need it. We want to reduce the burden. We want to have fewer front doors. You can keep advancing the slide. We want it to be scalable and reusable. So we have the capacity to scale up for a response or add new capabilities at a moment's notice. And we can readily bring in and handle more data from more sources and create new linkages for better insights and forecasting. So, and we're using multiple approaches inside these systems so that it's fast, accurate, complete, and usable for any disease or condition. So this is a big change for us, where we had, data systems and tools for each disease. We're trying to get away from that and move, to a more comprehensive. All right, next slide. Yeah, there's a lot of art there to pop through. So finally, while it's important to understand how DMI works and it's different, I want to close by emphasizing that, the future is going to be different because, we have to work together. We have to, success, in our opinion, means that we're decreasing the burden on our partners. We're freeing up public health staff to actually work on the public health content areas. We have awareness of emerging threats across the US, so we can forecast and provide resources and mitigate as needed. And like I said, we're already making progress. We've seen it through the COVID response that this is possible, that we can see these capabilities in a not too far off future. And importantly, we have a roadmap of how to get there. Obviously, we cannot do it alone. We need you all. We need your help, your expertise, your wisdom, and your commitment. And I look forward to working with you all to get this done. The last slide has my email. It's tdignam@cdc.gov, and feel free to reach out to me with any questions. And I'm happy to share these slides as well.
Awesome.
All right, thanks,
so
Chris.
very much, Tim, for being able to present on what CDC is doing. Greatly appreciated. So now we are going to move on to our panel discussion. And I do want to make sure that I introduce our moderator. Our moderator for the discussion will be Tim Callahan. Tim Callahan is an Evaluation and Support Program Director. As well, Tim is our Informatics Committee Chair for our organization. And a little bit about Tim. Tim has worked over 30 years in various roles of environmental health, including 7 years with the US Army, some time in industrial hygiene in the private sector, and 12 years as a county environmental health specialist. Since 2007, Tim has been in pursuit of a statewide data system to support field operations and general policy and resource decisions. He completed his fellowship in CDC's Environmental Public Health Leadership Institute in 2009 and earned his Master of Public Health from Augusta University. And Tim does represent Georgia Department of Health. Now we get to our panelists. And we're happy to welcome Rose Galbraith, drinking water epidemiologist. Rose is the New Mexico Department of Health drinking water epidemiologist and program manager for the Environmental Health Capacity Program. Rose coordinates program activities, including stakeholder education and outreach, unregulated drinking water quality surveillance, drinking water data analysis and dissemination, linking stakeholders and resources, building environmental health and water quality partnerships, and grant management activities. Ms. Galbraith has been with New Mexico for 8 years and worked in environmental health epidemiology for 6. Rose has 18 years professional experience, including biological science, environmental science, and epidemiology. She earned her Master of Public Health from the University of New Mexico and Bachelor of Science degrees in microbiology and environmental science from Oregon State University. The next person in our panel is Richard Gelb, which is an environmental health planner with Public Health, Seattle and King County, who works toward health equity and the built environment by bringing qualitative community priorities together with quantitative and spatial data on disparities in community conditions to inform planning, policy, growth management, and transportation decisions. He is currently coordinating policy initiatives on reducing highway pollution exposures, increasing access to toilets, sinks, drinking water, and addressing disparities in neighborhood scale health characteristics. And lastly, we have Christy Richardson. Christy Richardson is the Colorado State toxicologist at the Colorado Department of Public Health and Environment. As the Director of Toxicology and Environmental Epidemiology Office, she leads a team charged with using the best available data and science to provide actionable, accessible information on environmental health risks to people and policymakers. Christy and her team have provided information critical to policy changes across environmental programs in Colorado. Christy has a doctorate in environmental toxicology from the University of California, Riverside, and a bachelor's degree in biology from St. Mary's College of Maryland. And now I'm going to hand things over to Tim. So Tim, the floor is yours for this wonderful discussion.
Thanks, Chris. And I want to thank everybody who's participating in this webinar for making time to learn about environmental health informatics and about data and how things are going to be progressing going forward. We can learn how we're going forward by learning what people have done to date. And that's why we have these panelists trying to show their expertise and share with us what they've been able to advance and perhaps some insights as to how we can avoid pitfalls and make some greater advances going forward. So thank you to all for joining us. We shared the questions with you before this meeting, so you have some idea of what I'll be asking, but I'm going to go ahead and start out with just from the top of the list here. Apparently the screen isn't sharing who's talking at the moment. So I'm going to go ahead and pin some of the panelists to screens. And I don't know if I can pin more than one, but we'll see what we can do. As it is, I'm going to go ahead and start with Rose and ask the first question here. Can you give me some idea of how you're utilizing environmental health data in your day-to-day practice within your organization, and how you, let's just start with that. How are you typically using your data?
Yeah, thank you. So I will preface this by saying that the Environmental Health Epidemiology Bureau that I work in utilizes and shares many different types of environmental health data, and especially that's the focus of our New Mexico Environmental Public Health Tracking Program, and I collaborate very, very closely with them. My focus, as was mentioned in the introduction, is drinking water, so really I will mostly speak to that. I utilize data related both to unregulated drinking water sources, private wells, and small drinking water systems. And this data is used to inform our programmatic activities, like the types of educational materials and products that we develop and disseminate on the tracking portal. And through our drinking water toolkit, And it also helps prioritize areas for private well testing events, for example. And it's shared with our program partners and helps them prioritize their programmatic activities as well. And it really helps us all to better leverage our very limited resources and work with our stakeholders and implement public health actions.
So working with stakeholders is often a huge challenge with data. I see that, Richard, you have a note in your bio about trying to coordinate growth, managing growth in communities and transportation decisions. Is that a pretty common element of your day-to-day activity with data?
Yes, thank you, Tim. We have a focus on health equity in the built environment. And so I am challenged with supporting our programs in understanding disparities in conditions that their programs may be able to touch and remedy through allocating resources to those geographies and communities where needs are greatest. So we definitely have a strong focus on the health equity data considerations and working with the partners that help inform what matters in terms of environmental health disparities, because, you know, in most communities, Seattle, King County included, we have fairly pronounced disparities in the determinants of health. And so we're not going to be able to solve it all instantly, and we want to prioritize for those concerns and conditions that are of the highest priority for residents whose needs are greatest.
The area of determinants of health is not something that environmental health in general across the U.S. has been diving into, and it's really good to hear that it's working for you in King County. It'd be good to be able to grab those data elements that are a little less than traditional to bring them together like that. That's good to hear. And Christy, in your day-to-day activity, can you give us an idea of how you're using your data?
Yeah, so you know, I think I would just start with our office hosts the Colorado National Environmental Public Health Tracking Program. So we work really closely with all of the tracking data. We also, at our agency, we're one of the few state agencies here in Colorado where we have both the Department of Public Health and Environment in one agency. And I think that actually facilitates a lot of data sharing that might be a little bit more challenging for some other state agencies because we have both of those entities in the same shop and sometimes in the same building, and we have the same, you know, infrastructure and the same OIT folks supporting both of us. So that tends to help sometimes. I think, you know, where we are really trying to focus aligns with what Richard and Rose both mentioned. We have a really big environmental justice and health equity focus here in the state as well. So our environmental public health tracking program helped to build our first ever Colorado EnviroScreen tool. And this tool was built in collaboration with stakeholders. So we had a very rigorous engagement process that really allowed us to talk to disproportionately impacted communities and really understand what data they thought was important. And it helped us to really identify what data is available now and what data, where we might have gaps in that data. We also are working on a lot of emerging contaminants here in Colorado. So we have built a PFAS map for the state of Colorado that has all of the data for PFAS, per and polyfluoroalkyl substances. I know we like to throw around acronyms, and I want to make sure everybody understands what I'm talking about. So we have built a map that has all of the data that's been collected here in the state so far that we as a state agency have access to. And we now are in the final stages of turning that mapping exercise into a vulnerability map that takes into account not just the data on PFAS that we have, but also the known or potential sources of PFAS in the state, and also accounts for a variety of equity issues, as well as, you know, the population that could be using that water to help us better identify what areas in the state have groundwater that's most vulnerable to PFAS contamination and can help steer limited state resources to additional testing in the future. So I think overall, we try to partner across our agency. We work with environmental divisions in air, water, waste. We work with our preventative services division. We work with our disease control division, trying to pull all that information together to help understand where we have disparities. And, you know, I think we have learned a lot through the COVID process in terms of how we modernize data. And I think our group is trying to sort of leverage some of those data modernization efforts and the rapid access that we all needed to COVID data as it was coming in, as we were dealing with the pandemic, to sort of build off of that infrastructure to make sure that other data that's coming in, we have rapid access to that and can use it to pivot in a more timely fashion than government may have pivoted in the past.
I hear from that the tracking network has definitely been a huge help to a number of states. I can speak for Georgia. We're not a participating state in that. And we have the unique challenge of the number of counties we have and different agencies. It is a common problem with data sharing that it's a major issue with trying to actually pull stuff together. Let me ask this I'll go ahead and bounce it over to Rose on this one. In your area with New Mexico, how have you addressed the issues with data sharing? What obstacles have you run into and how do you overcome them?
How much time do you have? Well, you know, to keep the list short, the two biggest obstacles are time and limited staff capacity. And another kind of significant barrier is just developing a framework that allows the data to be useful to our stakeholders, but it's still protective in terms of potentially individual identifiers and things like that. In particular, I'm thinking in our case of our private wells water quality data that is entirely voluntarily contributed. So we want to be very cognizant of that. But I realize there's a lot of environmental health data sets with those kind of concerns. So I'd say for us, those are two of the biggest, but those aren't the only ones.
Any particularly huge obstacles you've had to overcome or things that you're still working on, Richard?
Well, the comments shared bring to mind the challenges around spatial data on environmental conditions and then kind of tabular data on health outcomes and how we seek to understand environmental conditions as they bear on health outcomes. However, the framing of those data universes may not line up. So yeah, to basically understand associations and identify geographies of concern may be challenging until those data sets are reconciled into frameworks that harmonize.
Yeah, data standardization to some degree, both in structure and as well as individual data elements to that level, can definitely be huge challenges. I'm going to go ahead and I want to throw this next question out to whoever wants to answer first, and that's, can you give me an example of where you actively have used data to inform a policy decision, and how was the data received by the policymakers and what was important to them?
Well, I raised my hand, so I'm just going to jump in and go
Jump
first
in.
here. Yeah, so we, like many other places, have naturally occurring radon here in Colorado. The entire state is technically at high risk for having elevated levels of radon. And our tracking program worked with our radioactive materials group to develop a data set showing both the risk of radon poisoning as well as the specific levels of radon that have been tested in homes, and along with some financial information about the cost for testing and mitigating radon compared to the healthcare costs related to lung cancer, as radon is the second leading cause of lung cancer. And that information rolled into a legislative bill in 2016 that provided funding for a low-income radon mitigation program here in Colorado. So we have now a program that offers free testing. Anyone in the state can sign up to get a radon testing kit. And then if you meet certain thresholds related to low income, then you're eligible to have mitigation system. If your levels are elevated and you meet the financial thresholds for low income, you're eligible to have a subsidized radon mitigation system installed in your home for free, or for low cost, depending on what your financial situation is. So I think that was a really great example of where we're trying to not only solve an environmental health issue that we know causes health problems, but we know that there's also disparities associated with people's ability to put those systems in their homes. So I think that's one great example here in Colorado.
And one thing that I've recognized myself is that return on investment message. As challenging as it may be to show those numbers, is a huge messaging element. Anybody else about how the policymakers are looking at the data and what you've used it for? Please do, Rose.
Thank you. One of our biggest successes in New Mexico, particularly in terms of unregulated drinking water, was really driven by data gaps and just the difficulty in tracking changes in individual wells' water quality over time, because it was tied to a well owner and not to a well itself. And through a multi-year effort with our partner agency, through my program as well as the tracking program, we worked with the Office of the State Engineer, who permits wells in our state, and it resulted in legislation that was passed and changes to our state administrative code that now require all newly constructed wells to have a unique identifier or well tag. And that's really going to aid in data tracking and disaster response and a lot of different better coordinated state agency activities moving forward. And that was in 2017. And a more kind of current data-driven policy initiative, of course, there's a big focus on climate change impacts. You know, I live in a southwestern state, and so we're really trying to leverage environmental health data to push forward, for example, a public health and climate resiliency program within the Department of Health that's being put forward to our legislature by some of our partners very shortly.
Okay, definitely getting that common element for where everything is helpful. If I may, I'll go ahead and throw out a question that came through in the Q&A here real quick. Referencing, if I can pull in Timothy Digman again, if he's open to talking some more. Actually, I believe he dropped. No, he's still here. A question came through for him. I'll bring up later. Sorry, I'm realizing that it'd probably be inappropriate now. Are you currently publishing your data? I'll go ahead and throw it to you, Richard. Are you publishing your data publicly or to open data forums or even just active participation with universities or other partners?
Yeah, we have several partnerships with academia and community-based organizations where we're sharing data. We're standing up an ArcGIS online open spatial data portal, which will serve up GIS data on a range of topics to other jurisdictions and municipal governments and community-based partners. And that, and we also directly publish information on conditions that are where disparity reduction is based in code. An example being for open space acquisition through our land conservation initiative. There's a formulaic way in which open space deficit areas are defined, and those geographies can be qualified to buy open space without a matching requirement. And that's all based on data that's publicly available on open space access and health outcomes that relate to the environment. And it's brought together in an index that speaks to open space equity. And so, yeah, those are examples of where we've partnered with external entities that are advancing policy initiatives, and we're providing data sets that feed the decision process.
Okay. How about Christy, are you publishing data out? I know with the tracking network, that's a standard part of that program. How much utilization, or how much, I mean, I presume you get analytics on it. How much is it being consumed?
Yeah, so that's a great question. So we do have our tracking portal that requires us to publish an amount of data. We also in the state have the Colorado Open Data Platform that has not just our Department of Public Health and Environment data, but lots of other data sets that are being made available. Most of those are geospatial data sets, so folks can download those and use them. Additionally, our group, because we're very committed to providing accessible information, is very dedicated to making sure that as much of the data that we use as possible is available. So in addition to making the data sets available through our own tracking program and other programs, as well as our partner programs like in air pollution or water pollution, we also are committed to publishing any articles that we publish in open access journals with all of the data available in GitHub, as well as all of the code available in GitHub as well. So as we're moving to using R more often now as a platform for data sharing and for developing user interfaces like the R Shiny platform, we are making that R code available as well. So our brand new EnviroScreen tool that was published this year was built entirely in R, and all of the code for that is available in GitHub as well. So, you know, I think we're really dedicated to making sure that our information is as transparent as possible, and that's both based on the data itself as well as the analysis we do to make the recommendations based on the data that we utilize.
That was quite a lift to get all that put on GitHub. I know. So Rose, oftentimes there's a hesitancy to putting data out, as that transparency is great, but sometimes there's various forces and partners that are like, I don't necessarily want this to be publicly available, impacting economy and their claims and such as that. Have you encountered something like that? And what kind of stuff have you been sharing?
Yeah, I mean, certainly, I think I've already touched on this a little bit, but that's always been a concern, and other states have also expressed the concern. Anybody handling unregulated drinking water data. It's not health information, but we do still try very much to be cognizant of the privacy concerns that a lot of our participants and our data providers do express to us. So our solution is to publish aggregated data, which can, you know, limit maybe its functionality and its usefulness to some stakeholders. So it's a bit of a balancing act, I'd say.
Definitely. Now here in Georgia, a note in the chat came about a question about septic data. Just that's all they put there. That's okay. I understand. Here, there's very few data systems that are putting out on-site wastewater system locations and data about them. We've been able to do some of that, and there's hesitancy there, but we've actually had far greater reception by folks like real estate agents, engineers, things having to do with eminent domain research, things like that. So it's been helpful because we've been able to have people absorb, you know, pull that data themselves, reduces some of the workload in the counties, as well as homeowners to better understand their own systems. The Q&A function is definitely available for questions that come through. Unfortunately, Tim Dingman had to leave us, but I won't be able to answer that question, but I'll refer it to him if we can get that answer. So obviously all this takes people. We have, you know, it doesn't, you can have the hardware, the software, you got to have the wetware, the people available to be able to do the work, to be able to understand how to do things. What staffing resources do you think would be of the greatest help to leverage what data you have and turn it into something good? What type of expertise would you be looking for? I'll throw that one to Richard first.
Well, we just hired our first GIS analyst, even though we've been carrying a bunch of GIS functions for years, obviously. So that helps. And then we have continuous improvement folks that are supporting analytics in terms of setting up the reports that feed supervisors the operational information about how field staff are performing and what needs are versus staff allocation for food and facility inspection and the like. And so, yeah, I mean, there is challenges around the staff readiness to both input and make sense of data. And a lot of those challenges can be mitigated when the systems are set up in a way that really streamline how the input and kind of preset reports are configured. And so anyway, we're just trying to improve the infrastructure that reduces the burden on staff and just automates how information can flow to be useful for various decision making.
How about you, Christy? Besides what you have with your tracking network, obviously you have a lot of field staff. Do you have training and challenges there for staff with help or elements, data-centric elements that you have to have staff ready for or available?
Yeah, so, I mean, I think a lot of the field staff across our department have upgraded to electronic data forms that they bring iPads and things like that into the field with them so they can directly input the data into the databases as they move through, and that helps to make sure that they're collecting the right kind of data. For example, if a field is validated that it has to be numeric data or a date or something, right? You can't miss that because you're trying to put it in and you'll get an error message in your little app that says, nope, this is not the right kind of data. I need you to get more information, or your data is not complete. So I think those have been really helpful in terms of, trying to make sure that staff understand what data to collect and why we need it and why we need it to be standardized so that not only they can use it in the future, but other folks can use it in the future as well. And then, Tim, I wanted to add something. I think, we have lots of people who are data analysts, and I think, the sort of skills that we're looking for are, some of them are the same and some of them are different. And we used to really want people who knew SAS, and now we really want people who know R and Python and all of those other sort of coding languages that folks have sort of moved into now. But a lot of the same fundamentals of, like, do you know epidemiology, right? Do you know how to analyze data? Do you know statistical methods? Things like that are really important. Another thing that we haven't talked about yet that I think is really important in terms of data is having people who can tell the story about the data and can help bring together siloed pieces of information and bring it together in a way that makes sense to either the community members or stakeholders or policymakers who are looking at the data. And, I think one great example from our program would be, we have what has been reported as the most polluted zip code in America here in Colorado. It's an area of sort of North Denver that has numerous environmental justice issues and health disparities. And there are hazardous waste sites. There's one of the biggest sources of pollution in the state, air pollution in the state. There's the largest wastewater treatment plant in the state, all in the same area. And so all of that information is siloed because we as regulators operate in regulatory silos that are set up by, regulations and funding streams and statute and things like that. And none of that makes sense to the public, right? They don't get that there's a different division or a different agency with a different funding stream that regulates waste versus regulates water versus, air. And so what we did was we built a website that pulled together some really high level information into a story map about that community and what we know and what we don't know about that community. And then we also built a more in-depth data dashboard that allowed people, so there's sort of like a baseline, easy to read website. And then we have a data dashboard that's for a little bit more of a sophisticated user. And then we have all of the data downloads and things like that for really advanced data users. So we're trying to make sure that people at different levels can get into that data and can use that data, and it's meaningful for them. So I think that's really important when we think about data. It's not just the data and having access to the data and having great analysts who can, tell us, all of these different things about the data, but we need somebody who then can go out and make the story meaningful to the people who are going to use that data to drive change in our communities.
I totally agree that the data-centric storytelling capacity is not something anybody teaches. And it's definitely something that usually requires you to have a knowledge base in the area of field of expertise, as well as the ability to understand, okay, where this data comes from, how it was molded, how it was shaped, and what it means, the interpretation. And that is where I see, at least here in Georgia, we've pushed a huge advance to try and get people that capacity to be able to tell a data story. From the field level staff all the way up, so that it's not just the websites they go to, but when they talk to folks, they can show them during the meetings, hey, this is what we mean. So that's my little input from Georgia. How about you, Rose? Do you see particular challenges or even opportunities to get more data analysis capability and informatics advancement?
Yes, absolutely. I mean, to echo what my colleagues on this panel have already stated, a focus on looking at that spatial relationship and building out the GIS capacity certainly is a big need in our state, but also something that we're really kind of focusing on, and this has been mentioned already, is looking at the environmental health data and its use from a health equity perspective, which is sadly something that we haven't really built up that much yet, and we are just really starting to dive into that now, and is something that needs to be built up for sure.
Agreed. There was once a concept that was advocated called built community, and it's still out there a little bit, but under the premise of being able to get that GIS capacity and that health equity, resurgence of that in combination with the data informatics would probably be a good thing for us to go for. So obviously these things aren't free. I'll start with you, Richard. Can you give me some idea of how you were able to leverage funding sources, or what kind of funding and resources you were able to put into action and turn into the great stuff you've been doing?
Well, we're still struggling there, so no great, final neat and tidy solutions. However, we do have a very strong partnership with our King County Information Technology Group, so that helps. We have a rate study underway to look at a more equitable way of charging for our services that will create a capacity to do something other than pay to play for inspection services, which we find to be somewhat inequitable in terms of and constrains our ability to pay attention to some of the upstream and system level improvements that we need to fund. We also have a new initiative, a foundational public health services initiative that was funded by our state legislature and provides some resources for locals to do kind of core, institutional improvements like data system improvements. So those are what we're cobbling together at the moment.
And Christy, you had the tracking network. Are there other areas of were you able to leverage beside, perhaps state or other federal funds or even just local funds to pursue what you've tried to get done?
Yeah, so we have not only the tracking grant, but we have two other NCEH funded programs. We have an apple tree program and a childhood lead poisoning prevention program. They're not as data intensive, but they do, require us to look at data, analyze data. And so those funds help as well. We also have some state funding. The biggest pot of state funding that we have is related to PFAS. And so that funding is supporting, that funding along with tracking is supporting all of the PFAS mapping efforts that we've undertaken or that we're still working on. And then we also have an air toxics program here in Colorado that just passed. The biggest part of it just passed this past legislative session. And that has also provided funding to try to pull together data on air and disparities that we see in communities. I think we've realized here in our state that regional air quality, which is assessed under the National Air Quality Control Act, is a little, the scale is wrong for the community concerns that we hear. They're concerned with air quality that differs, you know, street by street within a community and not at these really large regional scales. And so we have some state funding now to try to start pulling together more of this health and air information for smaller communities on smaller scales. And we have a lot of data challenges related to what that looks like and how we protect people's identity in those smaller scales. But I also do think it's really important because as we start to think about cumulative impacts in these disproportionately impacted communities, you really have to account for those differences because we can see much different air pollution levels, you know, just within a few blocks of one another because of either the dynamics or because of where the facilities are located and how the wind blows. It can all be really different within a census block. And we know that that's not going to be the right scale for our community. So, you know, I think we're just at the beginning stages of this, but we're really looking forward to trying to pull more of that information together as we get more community-based monitoring here in Colorado.
Definitely. Now, we are running out of a little bit of time here. Unfortunately, we could go on for hours. I know this group here would be happy to, but the folks who joined us don't have that kind of leeway right now. One of the items came up, Luis Rodriguez noted that the more data we collect, the more capacity we have to leverage that data into continuing funding, as in self-perpetuating capacity. The challenge is getting that initial thing started. And then Carla Shute, one of my co-lead on the Informatics Committee, was nice enough to post, for those who receive state funding, the question is, did your organization pursue legislation or something set down so that you had sustainable funding to continue making things happen?
I can jump in if you want me to. Ours is a combination. Sometimes legislators pursued proposed bills that then came across our desk and we had to think about the impact to our agency. And at other times, our agency itself proposed legislation to provide more funding to better respond to community concerns. So it's both for us.
Okay. And I'll throw this, I'm going to go ahead and jump to the last question here. Is how have you changed your operational and communication practices to help due to your investment in informatics? How have you shifted from old paper and nobody sharing much of anything to, okay, what are we doing now? So I'll throw it to Rose first.
Sure. So, you know, as a program level person, I'm not sure I'm the best person in my agency to really speak to this. Other than to say, you know, we're just going to continue to focus on sustaining and building those data partnerships, both those providing us the data as well as methods for disseminating it and having it being used for decision makers.
And Richard?
Yeah, I think one of the things I'm noticing is just the shift from concerns about population health to health equity and what that means for our information management challenges. And we talked earlier about standards around data, but one of the things we're struggling with is standards for measurement around concerns like disparities and how to identify where needs are greatest in a given the cumulative nature of some of the exposures. And so those are some of the challenges that we're trying to take on that will guide how we use spatial and tabular information to optimize service delivery.
Definitely. And because we're at the end of time here, I'm going to go ahead and throw my 2 cents in about how we in Georgia have shifted things. We have focused on ensuring that the district we have 159 counties with 18 districts. we have focused on trying to expand the capacity of the field staff and the management staff to look at data and interpret it and do that data storytelling. And it's been a huge help to us. But that was only due to the benefit of having a common data source, a standardization and governance in place. So that were huge lists for us, and we've had some success. However, that seems to be the focus on data modernization, as Timothy mentioned at the beginning of this, in that we have to de-silo, we have to modernize, we have to get some standards in place, and we have to invest significantly in it so it be self-sustaining. So I thank you all for joining us, making time to be part of this panel and answering the questions for us. I do need to hand this off to Becky and let her close this out.
All right, thank you, Tim. Well, I just want to say thank you to all of our speakers, Timothy, Rose, Christy, Richard. Thank you, Tim, for facilitating a really rich discussion, and to all of our participants that joined today. In the chat, you will see Chris Walker put his email if anybody's interested in getting a copy of Timothy's PowerPoint that he presented earlier. We'd be happy to send that out. And then speaking of data, and we know how important data is, Tim Callahan and myself both are evaluators. We do have a quick feedback survey. Once you close out of Zoom, it should take you to that survey. We'll also send it out via email. And we just really appreciate your feedback on today's webinar. We're going to be doing a series of these, so we really are going to take that feedback to heart, and we want to make these informative and useful with your time. So your feedback is very much appreciated. But again, thank you for all for joining today, and again to our speakers. With that, we'll let everybody go.